Between December 2023 and January 2025, 5 inmates died inside the Shasta County Jail. In a separate civil rights case, a single wrongful death lawsuit recently forced the county to pay a $12.75 million settlement. To understand how a Northern California county facility reached this level of lethality and financial liability, we have to look at the building itself. The facility was designed as a 484-bed, short-term holding center for people awaiting trial. It routinely operates at absolute capacity. Since 1993, the jail has been under a Superior Court capacity release order, legally capping the population at 90% of available beds to prevent unconstitutional crowding. These physical constraints left the jail with no margin for error. When state policy shifted the entire makeup of the inmate population, the building was already at its breaking point. In 2011, California passed AB 109, known as Public Safety Realignment. The state mandated that certain long-term felons serve their sentences in local county jails instead of state prisons. This bar chart visualizes the demographic inversion that followed. Notice the rapid drop in low-level misdemeanants and the immediate spike in high-security, long-term inmates taking their place. The county jail was suddenly housing highly sophisticated gang members, advanced drug smuggling networks, and individuals experiencing acute psychiatric breakdowns. A concrete box built to hold people for a few weeks was forced to operate as a maximum security prison and a psychiatric hospital, with zero structural upgrades. Securing a sprawling complex full of long-term felons requires a massive, alert workforce. But today, Shasta County simply does not have one. A 2024 to 2025 grand jury investigation found the jail operating with a 21.5% vacancy rate. In fact, the report notes the facility has been severely understaffed for 2 decades. To meet legally mandated minimum staffing levels, the remaining deputies are forced to work roughly 30,000 hours of mandatory overtime a year. Exhausted deputies miss things. Lethal contraband slips through the perimeter. In a recent 13-month window, 2 deaths were confirmed accidental fentanyl overdoses, requiring deputies to constantly deploy Narcan to keep the population alive. In the federal Adena lawsuit, attorneys alleged that exhausted deputies deliberately placed opaque magnets over the observation windows of isolation cells to conceal excessive force against inmates in psychiatric distress. To manage the soaring medical needs of this new population on a tight budget, the county outsourced healthcare to a private contractor called WellPath. Private companies operate on profit margins, which requires keeping overhead down. But the Constitution dictates that pretrial detainees receive adequate medical care, and specialized psychiatric intervention is incredibly expensive. Historically, suicides have accounted for roughly 65% of all jail deaths in Shasta County. That includes 27-year-old Juan Moreno, a pretrial detainee with schizophrenia, who died by suicide after being placed in an isolation cell rather than receiving immediate mental health treatment. This model of outsourcing led to severe medical neglect, triggering massive wrongful death litigation and millions in legal liabilities. The physical building itself complicates care. Narrow hallways and a lack of safety equipment prevent mobility-impaired individuals from accessing standard services. Because the general housing pods lacked handrails and accessible showers, staff routinely housed disabled inmates in solitary confinement cells just to manage them. This practice triggered the Jewett class action lawsuit. In 2018, the resulting settlement forced Shasta County to completely remediate structural barriers and hire a full-time ADA coordinator. A federal court also mandates routine assessments, strict compliance reporting, and specialized grievance processes to monitor the county's progress. The segregation of disabled inmates was the direct result of a county failing to maintain humane, compliant infrastructure for its vulnerable populations. The financial bill for decades of underinvestment has arrived. Between the $12.75 million Johnson settlement, the Jewett plaintiff's fees, and court-mandated facility upgrades, the county's budget is bleeding. In response to mounting liability and public scrutiny, the Board of Supervisors terminated WellPath and signed a massive new contract with a provider called Medico Correctional Healthcare. This line chart tracks the sharp upward trajectory of jail medical spending over the last decade. The new 3-year agreement costs $25 million, adding 10 full-time positions to essentially double the medical staffing on the cell blocks. That is a 40% jump in annual cost. The county is now paying a premium out of sheer desperation to buy its way out of federal liability. State-level legislation sent long-term felons to a local holding facility. The resulting strain overwhelmed a system that was already physically and operationally depleted. You can draft strict administrative policies and cite Title 15 state standards on paper, but if a facility lacks the deputies to conduct welfare checks, the nurses to distribute medication, and the architecture to house the disabled, the written rules offer zero protection. Shasta County is now forced to manage the high cost of utilizing a correctional facility as a primary solution for systemic public health failures. As the death rate remains high and legal bills mount, the jail stands as a warning of what happens when infrastructure is pushed beyond its design limits.